Good day, everybody, and welcome to Dr. Tom's Tips on Tuesdays at 10 in 10. Really appreciate the feedback we've been getting about this and happy to provide you with any kind of advice or tips regarding the Isolite. Today, the focus or the topic that we're talking about is what to tell your patient or new patients about Isolite. Good morning, Dr. Hirsch. How are you?
Hey, good morning, Rolando. Good morning, everybody. Thanks for tuning in on Tom's Tips on Tuesday at 10 today. We're going to talk about something today, some 20 episodes later, that we probably should have said at the very first episode we ever did. We have an Isolite. How do we introduce the Isolite to our patients? What do we tell them about this thing? How do we explain that? This is going to be a new concept for all of your patients that have not experienced the Isolite, and even for you. So first of all, you've got the Isolite, you've set the whole thing up, and now you're actually getting ready to start on a patient. So what do? I've got my patient seated in the chair. I have them open their mouth. I take a look in their mouth. I decide what size I'm going to use. I decide what procedure we're going to do. And here's how I go. And this, I'll just take it to you for a patient that I did yesterday morning. New patient came into the office. She'd fractured a mesial buccal cusp off on number 2. And so we've got to utilize this Isolite on number 2. So I took it out of the package. I said I need a medium mouthpiece for her. So I took the medium mouthpiece out and I got this and I showed it to her. First of all, I said, this is what we're going to use. This is an Isolite. And we're using this as probably something that you've never had in your mouth before. And the reason that we're using it is for protection, number 1. So the first tip is tell your patients it's for protection. It's for their protection. It's for the protection of the tongue and the throat and the cheek and from them swallowing anything. It's also for the protection of the patient that was just in the office before them. And it's also for protection in the patient that's going to come in after them. I said, well, what do you mean by that? And I said, well, besides this protecting your tongue and your cheek, this will also evacuate and reduce all the airborne aerosol that's going to be coming out of your mouth. So your germs will be coming out of the mouth if I wasn't utilizing this and going into our operatory and into our atmosphere in our room here, which is going to be, detrimental to the health of my staff, myself, and the patient that's coming in right after you. So we want to reduce all these things, just like we want to reduce them for when you come into the operatory and into the office and we're going to work. So that's the first thing that we do, and that's why we're going to be utilizing this. Okay, and so the patients understand that. And I said, so first of all, this is a really soft material, and I want you to touch it, and I want you to feel it. And so they pick it up, and they touch it, and they feel it. And so the patient that I was working on yesterday, after she touched it, she felt it. Okay, let's go ahead. So we took this, and I already knew she was going to be an apprehensive patient just from her demeanor and this and that and her history that we had. New patient to me also. Where normally I would have gone with a medium or a medium DV mouthpiece, I went with an extra small, only because I knew it was going to be an issue with her. So I went with this extra small mouthpiece and I put it in her mouth, and she's got this thing in her mouth. And immediately she's saying, I can't swallow. So I said, well, just relax for a moment. So the second tip is, after you put this in the patient's mouth, give them a period of adjustment before you pick up a drill and start drilling. Put this in the mouth, tip number 2, and let them adjust to it. And if they say they can't swallow, you can say, well, just take a moment, and I want you to close down the swallow. I want you to see that you can swallow. And then the next thing that I tell them is, and by the way, you're in control of this whole thing. So if anytime you ever feel a little panicky, you can just reach up and take it out of your mouth. And as I've said before in other clips of this show, putting the patients in control really goes a long way in the success of Isolite. So we had this in her mouth, and I'm looking at this whole thing, and I'm thinking, yeah, you know what, this is really going to be insufficient, and I know it's not going to work very well for her, but I put it in anyway. And I did a lot of this procedure dry because I knew there's going to be a problem with water and evacuation. So we kept the spray really light, and I put some little gauze squares around it and cotton rolls around it just to suck up the insufficiency of this thing. Sometimes what I've done is I'll sit down there, and nobody's going to want to hear this part of it, but sometimes I will start off with an extra small mouthpiece. And once I start working and let's say it's going to be a little bit more complex procedure where I've got to use a lot of water and I really need the evacuations, I'll switch it out to a medium or a medium DV. And sometimes that's what you have to do. One is not going to be sufficient, and we're worrying about our costs and our overhead. I get it. But sometimes you also have to consider your time involved in the procedure. If you're going to finish, go ahead, shoot.
I was going to say, by moving to a larger, the patient doesn't notice that?
No, they really don't. They've had this small one in their mouth. And you move. That's a great question. They just don't seem to notice when you go to a different size. You know, if I was going to go to from an extra small to an extra large, of course they're going to notice it. But going from an extra small up to a medium or even to a medium DV, they're just not going to notice that switch. And they may for a moment, but they've already been comfortable with this in their mouth. And so they say, hey, okay, that's just fine. Well, okay, so you spend an extra $3 or $3.50, whatever these things cost. You've done that. But what you've done is you really bought time with this. You just decreased the amount of time. And speaking of decreasing the amount of time, that's another thing that I tell my patients. I said, with this in your mouth, you're going to notice that the procedure is going to go just a whole lot faster. We may be finished in half the time as if we didn't have this in the mouth. I know you'd like to get out of here quicker and not have me working in your mouth for that long of a period of time. So that's another thing that I would tell them. So number one, first tip, explain about the airborne aerosol and the particles, and that's for their safety as well as my staff and the next person that's coming in after. That's tip number one. And number two, give the patient a period of adjustment when you put this in the mouth. Just let them adjust to it for a moment. And even if you have to, and I'm not saying that you do, but even if you have to switch to a larger size mouthpiece, that's going to be for your benefit and the patient's, because you can just get the procedure done that much faster. Those are my tips on that. Got any stuff that you want to throw in, Rolando?
No, that's awesome. So the context around eliminating the aerosols, especially now with COVID, that's a huge thing, and that's fantastic. You missed the letting them feel it. I think that gives them an idea that, all right, it's not this big scary thing. So that's cool. And then also, giving them the time to settle with it. That's really huge, and it's helpful. And then, I didn't know this. You put it in, and if during your procedure you need more, or you need space, or you need more seal, you can put a bigger one. And I didn't realize that the patient. I knew that the patient is comfortable with they can put more, but awesome.
So here,
that's awesome.
Yesterday, for instance, I know we got a little bit more time here, but I had 4 CAD/CAM CEREC restorations that I was doing yesterday. I started off with only one scheduled in the morning, and all of a sudden the day just got crazy on me. Thank God. I like when that happens. So the day just really got crazy, and somebody else came on with a fractured tooth, and another emergency came in. So I was doing, I did 4 CAD/CAMs yesterday. It takes me an hour and a half, 2 hours to do it start to finish on these things. One of the patients I was working on, I was working on the lower tooth number 30. And when I was working on tooth number 30, the Isolite that I had chosen, so I had 2 yesterday that I had to change mouthpieces on. The one that I had chosen was just insufficient. So I took a medium DV, and I know she was going to be a gagger, but I was able to take that medium DV and just taking a pair of scissors here. I can just take that thing, and I just cut the top. Oh, you can't see it, but I just cut the top part of that off like that. So when it went in her mouth, nothing was going up in her palate. So that worked out kind of nice for her also.
So make sure the patient is aware, explain it to them, let them touch it, give them time to adjust to it. And then if you need to, you can always put a bigger one in the middle of the procedure, and they will tolerate. Those are awesome.
They will. And don't be penny wise and pound foolish, compared to the cost of your procedure, whatever you happen to be doing. You're going to spend a few extra pennies or a few extra dollars, but you'll more than make that. If you save 1 minute on your procedure, you'll more than make up that time. And granted, you can't do anything with a minute, but if you're cost averaging throughout the day, those minutes add up, and they add up to a lot of dollars. They add up to a lot of big dollars that you can save just by the fact that you're going so much faster without trying to go any faster. You're so much more efficient. So it's just a great efficiency tool. Cool.
Awesome. Thank you so much, Dr. Hirsch. Really appreciate that. Those of you who joined us, thank you for joining us. If you enjoy these tips, or if there are things you're running into and you'd love to get feedback or tips from Dr. Hirsch, please let us know. Every Tuesday at 10 every Tuesdays at 10, you'll see the tips with Dr. Tom Hirsch. Thank you, sir. Appreciate it.
Sounds like a plan. Everybody be safe and get out there and let's get back to work and let's put this country back to work again. Okay.
Awesome.
Later.
Thank you, sir. Have a great one. Talk to you soon.
Thanks, Rolando. Thanks, everybody. Bye-bye now. Everybody take care.
Bye-bye.